No, Dr. ضرار, I should greet you for this because actually it's very rare to hear from a surgeon to talk about the psychosocial aspect and to have this holistic or whole approach of assessing patients. I must give a credit for you and for all doctors who are thinking like you. You sound like a family physician more than a surgeon. So I thank you for thinking in this way.
Thanks. So once we have the proper history and physical examination, and then we go to the second step, we have to obtain a chest X-ray. So we get the chest X-ray, and I usually ask for a previous chest X-ray that has been done before, just to compare if there is any changes or lesions found in X-ray. So the imaging technique is very important. Chest X-ray per se, the regular X-ray that we do it on in emergency department and other hospitals, is just a crude measure or a crude picture. It gives us an idea about what's going on, but doesn't give us a specification and doesn't give us a real details about lesions or the underlying lung condition.
So you go further to what step to get the things that you needed?
Then we go ahead and ask for a CAT scan, which is a CT scan. The CT scan is so important not only for diagnosis, as I mentioned. It's important also for to assess the extent of the disease. Yes. And assess whether there is other lesions or other or lymph nodes enlargement.
So CT scan is a must, and like you said, it's a cornerstone or important tool for the diagnosis of lung cancer.
That's correct, absolutely correct.
Yes, and not only for the lesion itself in the lung, like you said, you want to assess the spread in the lymph nodes as well.
Yeah, well, once we establish the investigation of lung cancer, we usually go parallel with investigation. So we ask for diagnosis, like a chest X-ray, CT scan, and at the same time we ask for some test that is important to tell us about the stage of the disease or to tell us about how advanced is the disease in that particular patient.
And like you said, this is important to know the staging because accordingly you will tailor the management plan for that patient.
You're absolutely right.
Okay.
Absolutely right.
Now, for those who went and had the investigation with the CT scan, now you localized a lesion or a tumor in one of the lungs. Now, do you go further to another technique, whether it's invasive or non-invasive, to know the nature of that tumor?
Again, this is a very good question and an excellent question. Is actually after. Sorry.
Yes. No, I'm starting to get calls now from outside. If the call is ready from Mr. Faris in Canada, we will. Yes, let's listen to Mr. Faris. Good evening, Mr. Faris. Yes, Mr. Faris, go ahead. You are on Healthy Life program.
Good evening. How are you doing?
Yes, thank you for calling us.
Yes, Dr. ضرار, nice to see you on the TV. This is Faris Rashid from Ottawa.
Yes, hi, Mr. Faris. How are you?
Good. How are you doing?
Good. Thank you very much. Always nice to hear you.
A question, please.
Yes, please go ahead with the question.
About if there is any research or maybe any cases that Dr. ضرار is aware of for people who are subject to people who are smoking with them in the same area. For example, a workplace, you are working in a place and people are smoking in that place.
Yes, this is very interesting question. I have actually a research for you and I will share with Dr. ضرار if he has more as well. Do you have another question, Mr. Faris?
Is that because, you know, this is a usual case for example, they are working with people who are smoking.
Yes.
And I don't know if there is any cases that Dr. ضرار can advise about what's the impact, what is the percentage of people who might be subject to lung cancer.
Yes, I absolutely agree with you, Mr. Faris, and I'm very happy to hear there are people from Canada watching our program.
Thank you. I am actually a neighbor for Dr. ضرار.
Okay, nice to hear you, and we'd like to hear from you
I
in
would like
the
to congratulate him.
Yeah. Thank you very much, Mr. Fas. Well, this is
Thank
very
you.
nice
Bye-bye.
From him calling.
Yeah, that.
Is he a doctor or he
No,
was
actually,
just a neighbor?
he's an engineer, and
Yes.
he was.
But he asked
was
a
neighbor.
very nice medical doctor, asked about a research.
Yeah.
If you are or me aware about the impact of being a passive smoker and still do you carry the same risk of developing lung cancer?
That's an excellent question, Mr.
Yes.
Faris. He's been always an intelligent man, actually. The second-hand smoking or passive smoking does have an impact on the non-smoker. It's actually the researchers showed that second-hand smoking, either working at the workplace or at home or
Wherever
here in
it is.
Kuwait, in Duania,
Everywhere.
unfortunately, exactly, in Duania, it's a disaster, actually.
Dr.
here.
ضرار, it's everywhere, even
Yeah.
in malls. When families goes, we are with children or without, you see people smoking everywhere.
That's correct. Those people are more prone, almost 3 to 4 times, to get lung cancer than the normal population who never smoked and never sat down with the smokers.
Yes, I do agree. And there's also briefly another study actually which was done on couples.
Yeah.
Married couples or partners when they are at home, if one of the couples, whether the wife or the husband is smoking and the other one is not smoking, just a passive smoker or like a second-hand smoking, there is a risk of up to 30% to develop lung cancer. Not asthma, lung cancer. So this is something very frightening.
It
This
is.
is to answer the question of Mr.
So
Faris.
the second, I'm sorry, but the
Yes.
second part of his question is my advice is try to establish a policy or protocol inside the working place, not to smoke inside the workspace.
Yes, and to have a separate room or isolate for those who are smoking.
You're right, absolutely
Let them
right.
affect their health by
So
themselves.
don't
yes.
harm others.
Don't
You're
harm
right.
others, yes.
Absolutely
okay.
right.
Actually, so we were talking now about those two research, but we would like, because still I'm getting calls, let's give viewers go for a very short break, and we'll be showing our numbers again, and we'll be back soon. Stay tuned. Welcome back. For those who started to watch us tonight, we are honored with the visit of very distinguished guest, Dr. ضرار الشهاب. He's a consultant in thoracic surgery from Chest Hospital, and we are discussing tonight two important topics, lung cancer and pneumothorax. My only worry is that the time will help us to finish the topics, but we try our best. Let's continue with the questions and the topic that we were discussing. We were talking about lung cancer with the suspicion, if we have it, what to do, and the serial testing. We reached that. We said the cornerstone for diagnosing it is the CT scan. But then I asked a question, if I have a lesion now, is there a more invasive, whether invasive or non-invasive, to know the nature of that cancer?
Well, yeah. After establishing from the CT scan that we have a tumor or new lesion found in the lung, then we take it to second level, which is the more invasive technique. I would like to know what is this lesion? Is it a real cancer or just a benign tumor?
Yes, and this is the worry of any patient when they have a lesion.
You're right, you're right. So what I ask for is some sort of biopsy, some sort of tissue.
Yes.
So we ask for a fine needle aspiration biopsy. It's a technique done by the interventional radiologist, which is just radiologists in the hospital, under ultrasound or under CT scan, mostly CT scan, and they try to target the tumor by a needle and try to aspirate a few cells that have been will be a process actually in the labs and to tell us whether it's a malignant cells or benign cells.
So this is to be confirmed with the diagnosis, and on what basis we base our management plan. Like you said, whether if it's benign or malignant, the management plan will be tailored according to the diagnosis.
That's correct. I mean, if it's benign, then we have to, like, just watch it or ask them for follow-up. But if it's malignant, then we proceed with further investigations and further management.
So the good news, when it is benign, there is a policy of following up how frequent the patient should come back to repeat the X-ray and compare, or the CT scan.
It depends on the patient's age and the patient condition.
So it's different from one patient
yes,
to another?
Yes, yeah.
Okay, now let's say it's confirmed lung cancer, and we are talking about the malignant type.
Right.
And now we are going to enter the management plan. What would you like to offer for patients to treat them?
So after establishing the diagnosis of lung cancer, I would like to know the extent of lung cancer.
Definitely, yes.
Why is that? Because it really changes our management. So we have to basically assess whether there is another lesions inside the lung or the other lung, whether the lymph nodes that clean, or the filtering system that cleans the lung or the tumor are involved in the cancer or not.
Yes. Can we show some pictures, Dr. ضرار, while we
yeah.
are showing just the structure of the lung and examples of some lesions, if we can
Sure.
show? Yes.
If you can see the monitor here.
If you
please.
show us on the monitor the picture that we